Good.
So, for a cardiovascular assessment, you're going to do your same assessment that you would for any other adult, but you are going to listen for some specific sounds. The older adult does have ectopic beats that are sometimes heard. They're just extra sounds. Don't be alarmed. That's a normal part of aging, and you may also hear an S4. That is not something you hear normally. Also, for your assessment, you want to be aware of the increased atrial resistance, the decreased cardiac output, the increased heart size and weight, the decrease in myocardial perfusion, and the increased time it takes for their heart rate to go back down to resting. And these are all assessment things that a nurse could find in an older adult.
Where's that?
Okay. To improve cardiovascular function, it's important to have a proper diet and proper activity level for older adults. A good rule of thumb is to avoid any fried, processed, or fatty foods. They contribute to hyperlipidemia, which can contribute to sclerosis and buildup of plaque. When cooking, it's a good idea to use monounsaturated oils, such as canola or olive oil, instead of saturated or trans fats. It's also important for those that have high blood pressure to reduce sodium intake. That can be found in lots of processed canned foods. As far as exercise goes, our book says that those who exercise in their middle age regularly improve their cardiovascular status. It's recommended at 30 minutes of moderate activity for 5 days a week, or 20 minutes of vigorous activity for 3 days a week can improve your cardiovascular function and circulation.
Okay, so you also need to talk to your older adult patient. If they are smoking, you need to talk to them about quitting that. And they can do the typical nicotine patch or nicotine gum, but they can also check out acupuncture. Since they're older, they might not want to be taking any more pills or putting more chemicals in their bodies, so that's an option. They also need to manage their stress. So take a walk, talk to them about easy yoga or meditation time, music therapy, all that good stuff that can help them relax. And they need to be proactive. So if they are drinking, then they need to consume fewer drinks during the week. They can take a 80 milligram aspirin to control their blood pressure, and they need to visit their doctor if something doesn't feel right and get daily checkups.
All right, the loved up
Perfect.
system.